In this video, I cover how I help to fix chronic migraine and tension headaches without injections or medications. Expect to learn the following. How do you tell if headaches are coming directly from structures in the neck? The difference between a migraine versus tension headache? What causes tension headaches? What causes migraine headaches? And how to get long-lasting relief from headaches without medications or injections. My name is Dr. Matt Maggio, and I am a soft tissue injury treatment expert, specifically for chronic headaches, neck, and shoulder pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain without the use of medications or injections, which leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. Just a reminder, if you're dealing with chronic pain in your neck, shoulders, or arms and are just struggling to get some real answers as to what is going on, you can submit your question directly to me. And if my insights can help, I'll be sure to get a video out to you. All the information to do that is in the description below. How to tell if headaches are coming directly from issues in the neck. A lot of people suffer with headaches and migraines and everything like that. And one thing that I always want to ask when I'm doing a thorough history of a client that comes into my office is really trying to understand if it's actually coming from structures in the neck. And a lot of times when someone does get like a full-blown tension headache or a migraine headache, I like to see that possibly they had some pain in the neck or even like down into the shoulder blades as well. And a lot of times it started there and then it became a headache. When I see that, I'm more accurate in the idea that it's actually coming from some structure in the neck and not something else, like possibly like deficiencies in minerals, different times of the month for females, all sorts of different things. I really want to know, was there pain in the neck or in the shoulder blades first and then the headache came out? Then I know for sure that they're in the right place for me to address those structures and try to get them fixed up. So there's a big difference between a migraine versus a tension headache. A lot of times migraines have a specific pattern where they might wrap around, go underneath the eye, top of the head, everywhere else in there. And a lot of times they also have more than just pain. There's also some visual issues, maybe some nausea, just not feeling good overall. And a lot of times they're very intense and you don't want to be in light. You kind of want to get into a dark area. Where a tension headache is just going to be more annoying, but it's going to be less intense than a migraine. It kind of like builds up, but it's not like, oh my God, I'm like in the worst pain ever. It's just really uncomfortable, but nothing as intense as a migraine. So, what structures in the neck actually cause migraine headaches? There's these really deep muscles. They're called your suboccipitals. They're right at the base of your neck. They're basically between like your skull and then the top two bones in your neck. And over time, I'd say with like bad posture, maybe sitting too long, looking down at a device, being stressed out, not moving enough, these muscles actually get overstretched. And when they get overstretched and overcontracted, they don't get enough blood flow and they don't get enough oxygen. And they start to develop this stuff called adhesion, also known as scar tissue. It's like a glue that gets inside the muscle. And it's the body's way of like really trying to protect that area and buffer it a little bit because that area is getting overstretched. So it thinks there's like an injury there. So it starts to lay down this adhesion and scar tissue in the area. Over time, when this happens, it causes the muscles to become less flexible and weaker, but a lot of times it puts a lot of pressure on those areas as well. And when those muscles start to get inflamed, they actually reproduce some of those migraine type of headaches. So a lot of migraines are actually coming from these deep muscles in the neck called the suboccipitals. And they're really deep. They're like right up against the bone. They're deep to the trap and they're hard to actually get to. And a lot of times when people try to get like a deep tissue massage or try to get some work in there, the provider is actually not able to get on those actual muscles, which is why the migraines continue to come back. So what causes tension headaches? Well, what actually happens is there's these really tiny nerves right at the base of the neck and off to the side here that get stuck to the muscles. And when they get stuck to the muscles, they get stuck with that glue of that adhesion or that scar tissue, and it causes what's called a nerve entrapment. And when nerves get stuck, they get really angry. Nerves don't want to get stuck. Nerves are built with about 10 or 15% of like extra slack to help them move throughout where they need to go. And when a nerve gets inflamed, it really triggers some of those tension headaches in there and can cause some issues as well. So there's three nerves which are called the occipital nerves that can get stuck in different areas. The first one is called the greater occipital nerve. That's the one I tend to see have most of the problems in a tension headache presentation. You can see on the photo here where it comes out, where it gets stuck and it gets jammed up right inside of there. Because like I said, when you're in that posture all day, looking down, staring at your phone, not moving enough, those muscles get pulled. They don't get enough blood flow. They don't get enough oxygen. It can actually cause that. And when you have a greater occipital nerve type of headache, it starts there and kind of goes up just like that as well. The next one is right next to there. It's just a little bit lower. It's called the third occipital nerve. Same type of mechanism, same type of problem where it gets entrapped in there, can cause issues as well. Really, when I'm trying to dial into like which nerve is getting caught, I really have to trust like my palpation and go in there and find and feel where those nerves are stuck. And when the nerves are stuck, they just don't move how they're supposed to. Like they lack what's called bowing. They can't like go from side to side very much because they're stuck there. And a lot of times they're very tender to the touch. And the client's like, man, I can really feel that, or it even reproduces some of the headache feelings that they're having when you go in there and actually feel on that area as well. And then the last one that can get caught is called the greater auricular nerve. I think I said that right. A lot of times when this one gets caught, it's usually more on the outside here between this big muscle here called the SCM and out there as well. And that can give more like a side type of headache and a presentation in there as well, and can cause some issues in there as well. So how to get long-lasting headache relief without medications or injections? The first thing is getting to a provider that actually takes a thorough history and figures out exactly what's going on. And that's what the providers that are trained in my method, called the PEAK method, do. They start by taking a very, very thorough history to know exactly where that problem is and to determine, like, is these headaches or these migraines actually coming from structures in the neck where we can help treat, or is it actually coming from something else? You know, maybe there's a nutrition deficiency, maybe there's an electrolyte deficiency, but we really need to kind of know what's going on. The problem in the current medical model is so much treatment is really just based on what the provider's trained in. So they're like, oh, you got headaches, we'll give you some injections, or you take these pills, or you do that. But a lot of times it's just an actual structural problem. And I'm amazed at the length that people will go to try to get relief from these headaches, take these awful medications, get Botox injections in the neck. And a lot of times it was more of a simple problem, but the problem is providers aren't actually looking for that. So basically, anyone that comes in my office or a PEAK method trained provider office or clinic, it starts with a very thorough and detailed history, then a functional evaluation. Then we're able to palpate and know exactly where the problem is. Because I always say, if you can't find it, you sure as heck can't fix it. And that's what's happening a lot. And sometimes people will go and get like deep tissue work and things like that, or an adjustment, but it's not actually addressing the root cause where these nerves are getting stuck or those suboccipital muscles are getting jammed up with all that adhesion. It needs just the right amount of tension and just the right amount of depth to go in there and actually fix it in a very high skill level. And a lot of providers just don't have that. So if you've been dealing with chronic headaches and migraines, I'd say for at least 6 months, you've seen way too many providers and you're still having issues, then reach out directly to us and request a no-charge injury consultation to get some real answers as to what's going on and get on the path to long-lasting pain relief so you can stay away from medications and injections and the current medical model, which really only makes things worse. All the information to request a consultation is in our profile or wherever you might be watching this video. I appreciate you watching it, and we'll see you on the next one. Bye.